Hello, everyone, and welcome to the Ask Dr. Shani channel. My name is Dr. Shani Collins Woods. I'm an assistant professor of social work and the curator of the Ask Dr. Shani channel here on YouTube. So, thank you for watching today. I'm here to talk about a very important topic, suicide awareness and prevention, with the subtopic Protect Your Mental Health. Before I get into the content of the video today, I kindly ask that you subscribe to my channel. And please know that on this channel, we talk about all things related to self-care, healthy boundaries, success, and faith and spirituality. And on occasion, I do unbox self-care items that I purchased to help with my mental health and just relaxation. So I like to share those items on my channel. But if you've been watching the news lately, you probably heard about the um, death of Stephen Twitch Boss, who was the DJ on the Ellen DeGeneres show for many years. He was not an actual DJ, but he served in the capacity as Ellen's sort of almost showrunner in a sense, or he was the person who she would bounce ideas off or jokes off on the show. He sort of was right there on the same stage with her, just over in the corner. So you've probably seen individuals like this if you watch the Sherry Shepherd show. She has an individual who serves in that capacity on her show, John Murray. So Twitch was that individual, and often he would get the audience hyped up and engaged with his dancing. He was a father, I think, to 3 children. He was married. And so I only knew him from seeing him on the Ellen DeGeneres show, which I had watched for many, many years and sort of stopped watching toward the end. But we learned this week that he unalived himself. Apparently, you can't say, certain words on YouTube, but he essentially is no longer here with us. And I wanted to talk about the topic that I feel is very important. I'm in social work, and so as a mental health professional and as a person who has been trained to diagnose mental health disorders and conditions, who often speaks about mental health, one who has often, been an invited presenter to talk about mental health at conferences and forums. I want to uplift the topic of ways to protect your mental health, especially during the holidays. We are here, it is December 16th, and we are fast approaching Christmas and the new year. And typically the holidays for a lot of people are filled with excitement and fun. But for everyone, the holidays are not, a time of excitement or joy. And so they can invoke feelings of anxiety, depression, um, and really bring up additional stressors, particularly around the area of finances. So let's get into the topic of what we're here for. So really, I want to just make this a short educational video on suicide. And I'm not sure if I'm going to get flagged for saying that word because I've seen a lot of YouTubers not use the word suicide. But this is an educational video, so I'm just going to go ahead and say what I'm talking about. But what really is suicide? And again, I have been trained. I've taken several trainings on suicide prevention. In 2020, I think the last time I spoke to the Tennessee Suicide Prevention Network, I'm in that network. So I am familiar with suicide and have taken ongoing trainings to actually talk about it as a community educator. So suicide is when a person has essentially taken their own life, and that can occur in a variety of ways. I'm not going to get into those ways, but what I really want to uplift and talk about is why suicide occurs and really what are the factors that lead to suicide. So really, we can talk about suicide prevention, but at the core of what we're really talking about is depression and anxiety and sometimes underlying mental health issues. And when we can really deal with those issues, the depression, the anxiety, address diagnosed or undiagnosed mental health disorders, then we can prevent suicide. So let's look at some of the signs of depression. What are the signs of depression? I'm very familiar with depression. I wrote my master's thesis at Clark Atlanta on depression among African American women at a historically Black institution. But just some general signs of depression. I'm not going to get too deep into this video, but things can look like when an individual starts to present with sadness. Now, we've all been sad before. If you have taken a test and failed, it may make you sad. If you have a loved one who is in the hospital, it may make you feel sad. If you have experienced perhaps a letdown or a disappointment, that can make you feel sad. We've all experienced sadness. But what we're talking about when we're talking about depression is really persistent feelings that last for 2 weeks or longer. Okay. So when we start dealing with persistent depression, that can get into their levels of depression, mild, moderate, and severe. Mild depression is kind of like, I may not be feeling my best for a couple of days, but it really doesn't impact my activities. When we start talking about moderate to major depression, it disrupts your day-to-day functioning. Okay. So you're really not wanting to get out of bed. You're really dealing with a lot of insomnia, the inability to sleep, or hypersomnia, when the individual is like oversleeping, like you're asleep all day, just the opposite of insomnia. There may be restlessness. There may be feelings of anxiety, feelings of, really being very codependent, or to that opposite, you can want to isolate yourself or not really want to be around other individuals. But often with depression, there is a withdrawal. Okay. There can be, again, that persistent sadness. There can be even some psychosomatic things going on. So what you're feeling or thinking in your head, it starts to manifest into physical symptoms, such as like you can get a stomach ache or have headaches or backaches. So I encourage you to go look up some of the signs and symptoms of depression. So when a person has this unresolved depression, right? They're dealing with depression, and we're just going to say it's at the highest level. So it's moderate to severe depression. Okay. They're not really wanting to get out of bed. They're presenting with a lot of these other symptoms, feeling aches and pain, feeling lonely, withdrawing, not want to go by their friends and family, not picking up the phone. When they're dealing with that for a long period of time and it's unaddressed, and perhaps friends are noticing, family members are noticing, hey, what's going on? Can I help you? And the person is persistently saying, I'm okay. I can deal with it, or I'm just going to push through. I don't really want to talk about it. That's when a person really starts to withdraw, really starts to retreat. And what suicide does, it makes the person feel like they are isolated, that they are alone. Their thoughts become all consuming, right? So you start moving from thinking about, I'm severely depressed, or this issue is the largest thing in the world, to this issue is so big in my life, I don't see an end to it. So the best option for me is to take my own life. So depression leads to suicide. So again, if you can deal with the depression, the anxiety, or even some unresolved mental health disorders, then you can prevent the suicide. But again, when it comes to suicide, the individual who is experiencing it has to really reach out for help or accept the help. And oftentimes, what people start experiencing when they start dealing with suicide is suicide ideation. Okay. Remember, it starts in your thoughts. So a person may say, you know what? I have this financial situation going on, and I don't see an end, right, to my situation. It's the holidays. I have to pay for kids' toys. I have to pay my bills in the new year. I don't get paid until a certain time. I don't know where the money is coming from. I robbed Peter to pay Paul. I don't see an end to this situation. So it's best that I'm going to, check out of here. I feel hopeless. I feel helpless. I don't have resources. And perhaps they've called, they've spoken to people. People are dealing, we're in a pandemic. It's a crisis for a lot of people across the world. And so maybe that person experiencing suicide ideation, those thoughts, is kind of saying, I just don't see an end. And so what happens when an individual, really, follows through is that they are following through on those thoughts that are telling them, hey, this is the end. There's no other alternative. This is the only way out for you to end your life. You will be better off. You wouldn't be a burden on others if you're not here. So we have to understand that it starts with those thoughts. So everything that happens, what we think, we manifest into actually the actions that we take in our life, right? Okay, so that's suicide ideation. And when you think about statistics, according to the CDC, about 12.2 million, this was in 2020, they thought about suicide, meaning they had suicidal thought within any given year, within that year. 3.2 million people made a plan, and 1.2 million people actually made an attempt to commit suicide. And so when an individual starts making an attempt to commit suicide, you know, if they don't get the help they need, they're often going to carry out the actual suicide. And so again, we want to prevent it by dealing with depression, dealing with the anxiety, and getting our unresolved mental health issues taken care of. So again, what can be done to prevent suicide or to bring more awareness to it? First of all, again, recognize the signs of depression and anxiety. Again, I talked about those feelings of not being worthy, thinking about suicide often, thinking things are the end, that's suicide ideation, withdrawing from your normal activities, finding no pleasure in your normal activities, sleeping all day, not wanting to get up, not wanting to engage, or staying up all night where or just for days where you're just not able to get what you can do. Avoid those negative thoughts and those negative feelings by really countering them. For me, I'm a Christian. On this channel, I talk about and uplift Christ. So countering them with the word of God, but also getting the therapeutic support that you need. Okay. So finding and reaching out to a licensed, experienced mental health professional. It's not just enough to pray things away. We can't pray everything away. Sometimes we really need to go and sit in a therapy session and talk to a licensed clinical mental health, whether it's a licensed clinical social worker or some psychologist or psychiatrist, a mental health professional who can help get you help you identify coping skills and get you to the resources that you need to deal with the depression, to deal with the anxiety, and to address underlying mental health disorders, whether that's through a treatment plan that includes medicine or no medicine. Okay. Find a way to cope with life stressors. I remember talking to individuals who were in a behavioral clinic setting, and many of them were in there because they had attempted suicide. And when we would do group therapy, we would often talk about the need for identifying coping mechanisms. Oftentimes when we are dealing with life's stressors, we don't have the coping mechanisms to really deal with things. Okay. So if you start to identify your coping mechanisms or help your friends who may be dealing with depression identify coping mechanisms, this is a way that we can steer people away from suicide. So for example, if a person has had or is dealing with grief, maybe that's a loss of a human being, relative, parent, child, pet, grief is really palpable and you feel that and it doesn't go away, okay, right away. You deal with it for a lifetime for some people, but it comes in stages, it comes in waves. But every time something happens to us, we can't always say, okay, this is the end of the world. We have to be able to think through ways that we can cope even with grief, whether it's grief, heartache, sadness, depression, work stressors. So that's where those coping mechanisms come in. Okay. And so a coping mechanism might be like, okay, yes, a person can say, I'm experiencing grief. I just lost my pet, or I just lost my parent, I just lost a neighbor, a friend, or I lost my job. I'm dealing with some level of instability in my life. I'm not feeling spiritually connected. But instead of me, just saying I'm going to leave this earth by my own hands, let me think of ways that I can find resources or I can find ways to cope. Can I say, yes, this is bad. Yes, I did lose my job, but it is not the end of the world. There are other jobs. I can apply for another job here. It may not be the job that I want, but it may be something that I have to take to get to the next level. Yes, my child died, or yes, my parent died, but they may be out of their suffering. They may be in a better place if you're thinking about it from a spiritual perspective, okay? Yes, I'm having issues at work, or I may not particularly, get along with my coworkers, but it is not the end of the world. I can find ways to still have professional relationships, but not, take everything home with me and not take everything so personal to the point that it's seriously impacting my mental health. Also, I remember being in behavioral clinical settings and working with clients, I would often tell them to develop a safety plan. And the safety plan is this. And whether you're a person is suicidal or not, everyone needs to have some level of a safety plan. And that is your plan of action if you are really having a mental health crisis, or if you live with someone who is, having some mental health concerns. You want to have a safety plan, a way so that everyone knows, okay, these are the steps that we take if this person is suicide ideation. And what that plan may look like is, you carving out on a sheet of paper, or having an example on the refrigerator, and it says, okay, if Jonathan is, experiencing a lot of depression, we use this coping mechanism. Okay, so maybe we're going to take a 30-minute walk, or maybe we're going to, have a 45-minute session with our therapist, or maybe we're going to make sure all medications are current and that we're adhering to the medicine schedule. Play going to the level where a person is committing suicide. So that safety plan needs to be visible, and it also needs to have numbers of individuals you would call. For example, let's say Jonathan is feeling like Jonathan's alone or by himself in the home, or Sheila's alone or in the home by herself. Who does she need to call if she starts to feel concerned, feel anxious, or is, experiencing suicide ideation? She may need to call her neighbor. She may need to call 911. So have those important numbers in place. So have that safety plan visible so that it's a constant reminder that, hey, these are our coping mechanisms. But if we aren't able to use our coping mechanisms and we need some additional support, this is the first person to call. If that person doesn't pick up, this is the second person. And you have about 5 or 6 numbers, and you make sure 911 is also on that list. And so, again, another thing that's going to be very helpful when we're talking about combating depression and anxiety is having sort of structure in your life and having a plan for your day every day. Routine and keeping things in a routine way helps you know what you're going to do for the next step, the next hour, the next month or so. And so I'll give you an example. You may say, okay, I get up in the morning at 7 o'clock. That's what I'm doing at 7. By 7:30 or 8 o'clock, I'm saying a prayer. By 9 o'clock, I'm hitting the gym. By 10 o'clock, I'm working on project one. Okay, I'm working on whatever work project or whatever thing it is I need to do. I'm doing that by between 10 and 11. Around about 11:30 to 12, I'm going to take a lunch break. When I get back from my lunch break, probably at 11 o'clock, or maybe from 12 to 2, I do some more work, or I work on a different project. Then I call my therapist around about 2:30 or 3. Okay, so I'm winding down the day, moving through my day about 3 o'clock. So around about 3:45, I watch an inspirational video, something to keep me motivated, or a funny video. Then it's time to really leave work. You gotta do some more work in my work setting or whatever project I'm working on. Around about 4:30, I head out from work, get ready to go have workout number 2. Okay. I know I'm going to see some people who may bother me or may not necessarily, want to interact with in the gym every time I meet. Brandy in the gym, she's negative, talking about her boyfriend. I'm just not in that mental space. Okay, so avoid Brandy, go the other way, work out on a different piece of equipment. My point is avoid negative people and negativity, okay? Because you're working on your mental health and trying to protect your mental health, okay? So then after you do that good workout, around about 6 o'clock, you say, hey, it's time for me to get some self-care in, whether that's meditation or me just taking the opportunity to sit and reflect, to be quiet, to do something fun and engaging, or just to do nothing. Okay. And about 7:38, the next few hours, I'm just winding down with essential oils. I'm avoiding things like alcohol because alcohol is a depressant. I'm avoiding caffeine because caffeine will make you stay up longer. And if you have insomnia already, you do not want to stay up. Okay. You want to be thinking about going to sleep, relaxing, because when the body is relaxed, it helps your mental health. When you reset, it gives you the opportunity to expand and increase your mental health. And so you have positive mental health. And working out is so essential to your mental health because it stimulates your body, it makes you tired, it makes you sweat, and it helps you work through any stressors and anxiety. So those are just a few things that we can do when we really start talking about suicide. When we talk about ways to prevent suicide, we're really talking about dealing with the underlying issue that really contributes to suicide. And that issue is depression, anxiety, undiagnosed or unaddressed mental health issues. So I encourage you, if you're watching this video, if you know someone who's struggling with their mental health, especially during the holidays when seasonal affective disorder is very prevalent among many people. And what this means is that when the seasons change, for example, we move from summer to spring, people can get depressed. When we start moving from spring to autumn to fall, depression can sit in. When we move from fall to winter, definitely with the climate, depression can sit in, and it can occur for people at any particular season. So just be mindful of that the holidays, the seasonal changes, us being in the pandemic, us and just as in this country and this world, dealing with financial crisis, dealing with so many traumas on TV, things that we see day to day, those things can cause us to feel depressed. They can make us feel a sense of anxiety, feel a sense of stress, and feel like we really can't help. But you are worthy. You are valuable. God has put you on this earth for a reason. And it's very unfortunate about Stephen Twitch Boss. And I send my prayers and support to his family and to anyone who is dealing with suicide or who has a relative who has committed suicide, because it impacts not only the individual's family, it impacts the whole community. As you can see, the impact that we are all feeling and thinking about Twitch, who was on the Ellen show. So that's my nugget of wisdom, my inspirational vitamin. Get the support that you need. Identify positive people. Stay in positive environments. Recognize the signs of depression within yourself. Okay, we all have to become self-aware. We all deal with it, whether it's mild, whether it's moderate, or whether it's major. Get the support that you need. Find accountability partners. Don't isolate yourself. Draw to people, but positive people, and get the support that you need so that you can protect your mental health, your mental peace. Identify your coping mechanisms, and don't say you don't have any. Well, if you feel like you don't have any, you need to work on getting some. So Google coping mechanisms, coping skills. How can you cope with life stressors? Because life is always going to stress us out, and we can't always, just throw in the towel. We have to really figure out ways to cope and ways to be resilient. We are resilient people. And lastly, think about that safety plan. Put that safety plan in place. Make sure it's visible. Have your accountability people on speed dial, those who you can call. Find people. People love you. They will support you. They will sit with you and labor with you. So never think you're burning on anyone else. And make sure you try to keep things in a routine pace in your life. I'm doing this at 3 o'clock. I'm doing this every day, because sometimes when we get off our schedule, we become disorganized, and that makes us feel more stressed out. So try to keep a schedule in your life. Keep schedules going, and it doesn't have to be a real strict schedule, but keep a schedule so that your mind knows and your body knows what's the next step. You know what to look forward to. You have something to look forward to. So again, I'm closing out again, but that's my message. Thank you so much for watching this video. Please give this video a big thumbs up if you found it to be helpful to you, and tell others about the Ask Dr. Shani channel. And I look forward to talking to you again in the future. Merry Christmas and happy holidays to each of you. Take care.